There we go. And we are live. Happy Sunday, everybody. Welcome to another episode of our Wellness Weekends here at Centro Holistico. My name is Kathy Ranieses. I also work as the resident life coach. And with me today is Dr. Kat Miranda. She's an internist, a functional medicine practitioner, a certified health coach, and a medical acupuncturist. And she is also one of our Centro doctors. Hi, Doc Kat. How are you doing this morning? Kamusta?
Hi, good morning. Happy Sunday morning. And then to everybody who's listening, thank you for watching us for the past few Sundays, diba? So, thank you. Ayan. Good
Yeah,
morning,
grabe,
Kathy.
no? Parang sobrang ang bilis ng panahon. Bukas March na.
Oo, no. Sabi ko nga, tama, no? This is well, at least the last installment for this series, no? So, for the past few Sundays, parang, okay, so ito na tayo ngayon. So,
Yeah.
So, happy to be here.
The first quarter of 2021 is just flying by. Parang feeling ko parang kahapon lang. Like January pa.
Oo, magpa-March na. Oh my gosh.
Like everybody's still stuck indoors though. Which is kind of sad. Pero vaccines are on the way, hopefully. And yeah, so for this episode of Wellness Weekends, we wanted to talk to everybody about cardiometabolic care. So let's just get into it, Doc Kat. What is cardiometabolic? Because for me, parang I hear two things. I hear like cardio, something to do with the heart, and then metabolic is like something to do with like how fast or how slow I gain weight. So can you explain that a little bit?
Well, Kathy, actually, you're not far from that naman, no? So tama naman, just to simplify it, when you say cardiometabolic, actually, it's very broad, actually, if you think about it. So actually, I think sakto lang for me being an internist to tackle this topic, no? So cardiometabolic, so cardio, you're correct. So anything with that has to do with the heart, the circulation, ayan. And then metabolic, again, another, yan. So that would be any kumbaga processes in the body, yung tinatawag natin metabolism. So there comes in naman about sugar metabolism, carbohydrate metabolism, fat metabolism. So doon papasok na yung sa diabetes, that's the most when it comes to my practice as internist diabetes, being overweight, ayan. So those are mga metabolic conditions. So and any organs in our body that processes for metabolism, that's part of the metabolic, in the cardiometabolic spectrum. Ayan. So
Got it. So what I'm hearing from you is basically how our body metabolizes certain things and how it affects the heart. Tama ba?
Well, the heart, and yes, correct. That's why most of the time it's interconnected. So any problem with the metabolism can affect also the heart primarily. So, diba? That's very important sa atin So, yes.
So Doc, what happens if we don't take care of our cardiometabolic system, basically?
Nako. Like I said, it's very broad, no? So if you're not taking care of your cardiometabolic system, it's like you're not taking care of your whole body. Kasi the heart, remember, I mean, once it stops, you're gone. You stop. Okay? So that's the heart. It's really the master, diba? Makes us move, makes us breathe, makes us, makes us function. Ayan. And then, in conjunction with that, is the metabolism. So our heart wouldn't function if it doesn't get yung proper metabolism from the other organs. So I'm not saying heart lang is important. Syempre dyan, important ang liver for detoxification, important yung metabolism of whatever we eat, di ba? Any food intake that we eat. So it would also affect the heart. Yan. So, and also yung mga ibang processes in the body that, basically nga, anything that you do with your life, with your lifestyle, with your body, it really, yun na yung mechanism mismo. So, like I said kanina, it's very broad. Baka abutin tayong 2 hours dito.
Sige. So let's kind of like shrink it down into certain topics. Kasi based on looking at my family and based on looking at my friends and like some of the things that they're going through, parang parang ang maraming common sa ating mga Pinoy, like, like issues when it comes to like cardiometabolic. Like I get a lot. I have friends who complain na nandun na tayo sa edad na complain
Ayan.
about hypertension. I have family who like have issues with like high cholesterol. My dad was a diabetic. And like, and I found out a couple years back that like the number one pala killer for a lot of Filipino men is cardiac arrest, or or basically having a heart attack. And that's all to do with our cardiometabolic system. Tama ba?
Yes, parang the interconnection of all of it, actually. Diba, like
Mm,
I said, our heart, yan, it's a very hard-working organ. I mean, one of the very hard-working organ. Kahit tulog ka, di ba, nagpa-pump pa rin ang heart natin.
mm-mm.
Our heart starts as we conceive, as our organs develop in, di ba, the tummy of our mom, nagbi-beat ng heart natin. So, until we sleep, di ba, tuloy-tuloy di ba?
Oo.
So, imagine, so, parang kaya well we have this notion no kapag naalala ko lang sabi mo with your family no parang we have this notion I don't know if Filipino family lang or everybody no na parang
Mm.
when we age sabi nila normal na ma-high blood ako or normal
Oo.
na may sakit na ako dok tumatanda na talaga ganyan talaga parang ganon but
Oo,
ako I
yung
beg
alam mo yung parang social status yung may ano ka,
oo
yung may pang-BP ka sa bahay. Kasi di mo
parang
kailangan pumunta ng clinic.
parang rite of passage na matanda ka na kasi may high blood ka na. Alam mo yon pero I always tell my patients na no. Or isa pa, ganito, sabihin nila, nasa lahi, dok, na high blood, so magkaka-high blood din
Yes.
ako. That's so
Mm.
sad kasi, well, we have, it was ingrained to us, I think, even when I was studying med school, no, parang, yun nga, when you're high blood, we're diabetic because it runs in the family, in the
Yes.
genes.
So is that
So,
true? So that
I,
diabetes, does that mean I will have diabetes eventually? Or
ang
be more
lungkot
prone?
ang lungkot naman ng buhay mo kapag gano'n, 'di ba? Lumaki ka, nanay mo diabetic, tatay mo hypertensive. So parang ikaw, as you grow up, I know what I will be when I grow up. I'll be a hypertensive diabetic patient. Pero ano mo yun, parang and sometimes parang you tend I mean, I see this in my patients because
Mm.
I also work in a wellness center in a annual where you do annual checkups. So I see
Mhm.
patients na gano'n, no? So,
Yeah.
parang when you ask the history, yan, may sakit sa lahi, high blood, diabetes, father, ganyan. So, parang, or pag yun nga, naka-maintenance nila. So, they're saying, kasi nasa lahi po. So,
Yeah.
tapos yung mga younger generations, ganun din. So, parang ako, actually, here's the thing, ha. Yes, we've been told na nasa genes yan. Okay? Hindi mo naman kayang palitan ng nanay at tatay mo, di ba? Pero here's the good, I mean, this is what I always emphasize to my patient. Actually, you can do something about it to prevent that one.
Mm-mm.
Kasi as we follow, I mean, as I believe nga, di ba, parang ganito yan. Genetics loads the gun, pero the environment and your lifestyle will pull the trigger. So, if you, parang, you will have that setting, you will have that, pero you need, parang merong magsi-switch on pa niyan bago
Oo.
ka talaga tuluyang maging hypertensive or maging diabetic. So,
Mm.
technically, what I'm saying, pwedeng hindi ka maging hypertensive as you grow up. You can
It's a
still have your
choice.
other dreams. It's a choice,
It's a
actually. Okay?
choice. Oo.
So,
I don't
if
I don't
you,
think a lot of people realize that na it's a choice, because nga parang yes, like like you said, because it's in their genes, number one, and then number two, parang kung halimbawa, like if it obesity is in your genes, pero your family, you guys eat a certain way, common sa inyo yung 2 to 3 cups of rice kada kain, and that's your normal, you're really going to fall
yes.
into that, tama, right? In
Yes.
this.
So, that's the lifestyle na sinasabi
Oo.
ko. So, it doesn't
Oo.
have to do with the genes Kasi, kaya nga, I guess kaya nga eventually most would end up like their parents who had those conditions because they practice the same habits sa home pa lang, di ba?
Yeah.
So, the parents would be, let's say, hypertensive because they tend to have poor eating habits. Syempre, yun naman susundin mo as you grow up also. Akala mo that's the normal
Correct.
eh.
Oo.
So,
Yun yung
ayun, so,
nakasanayan mo, like you don't know any
yes.
better.
Oo, yeah. So that's why that's why I'm glad nga in our practice we tend to emphasize on that. na
Mhm.
parang your genes are not your destiny, di ba? It's still
Yes.
your choice. So, that's why when I see patients sa sentro, di ba? Kaya we here at sentro, parang even though na wala ka pang sakit, you're not yet diagnosed of any medical condition, come visit
Mm.
us. Kasi it would enlighten you a lot when you get our 1 hour consult. Ayan, required yan, 1 hour consult
Oo,
ang kasi you cannot talk about your lifestyle, your in just a few minutes, di ba?
correct.
So,
Actually,
that's why,
that's one of the, like, when I started my journey with Centro, yun yung para sa akin sobrang kakaiba. Kasi usually I sit down and the questions are, may nararamdaman ka ba? Like, saan siya masakit? But with you guys, a lot of the questions were like, like, how much sleep do you get? Like, stressed ka ba? Ano
ang
yung
kulit
itsura
namin, di
mo?
ba?
Parang pati pa naman yun, gusto niyong alam.
Parang masyadong chismosa kami, di ba?
Oo.
Oo.
But then, like, going through the journey, parang nag-gets ko kasi it really is parang doon ko na-realize nga na lifestyle talaga plays such a huge role in yung mga lumalabas na mga sakit-sakit sa atin, and just realizing how much of my bad lifestyle was so normal to me.
Mm-mm.
Like, somebody had to say na hindi normal yan. Like, like, working and being really stressed out all the time. Sa akin was like, it's normal.
Oo.
But,
Kasi
somebody
it's
had
not,
to say, hindi tama yan.
kasi sasabihin nila, parang it's not killing you, but it's actually killing you slowly inside, di ba?
Exactly. Yeah.
So, and then, when is it the norm na parang, yun nga, it's sad na parang normal na sa'yo yung uuwi ka masakit ang katawan. Diba? You're not listening to your body. Actually, we have this what we call wisdom of the body. So, if you listen carefully with your body, you know what to do. Pero tayo, we tend to deny that. Example lang like I mentioned kanina, no? Hypertension. So, again, lahi, diba? But, if you live a very stressful life, you can get hypertensive even earlier
Yeah.
if you have that predisposition, 'di ba? Kasi stress talaga, I mean, yeah, kulang sa tulog, that's stress in your body na 'di ba?
Yeah.
Kahit na sabihin natin na nakakagising naman ako, na nakaka-up and about pa rin naman ako. When we were younger, okay yan. Kasi we still have these reserves of nutrients in our body na to make us okay pa din.
Mm-mm.
Tapos magtataka ka pagdating mo ng certain age, sabihin mo, hindi ko na kaya kasi matanda na ako. Kasi pinush mo na yung body mo after how many years, right? Yung
Oo.
years of not sleeping, years of poor diet. So, hindi nga nakakagulat na you'll get what your parents had. Diba?
Correct. And I think, like, we also have a lot of limiting beliefs around taking care of ourselves.
Correct.
Like, yung mga sabihan na, like, sleep is for the weak. Alam mo yun, na parang if you get in a certain number of hours per day, tamad ka. Na the less sleep you get, ay, ang sipag niyan kasi 4 na oras lang yan natutulog.
Oo, diba? Kailan pa naging, well, yun nga, that's sad Parang sa society natin, we tend to not neglect health because we tend to, parang, we tend to do what is, yun nga, sa work, di ba? Parang life gets in the way of
Yeah.
your health.
Mm-mm.
When in short, I tell my patients, trabaho ka nga ng trabaho. Sige, for your kids, for your future. Pero kung magkakasakit ka, yung tinrabaho mo for the longest time, mapupunta lang sa maintenance meds mo, di ba?
Correct. Sayang.
So, sayang, di ba? Nagtrabaho ka pa ng matagal, it
Oh,
took away time with your family to work hard, and then at
mm-mm.
the end of the puro ka na maintenance meds. You cannot enjoy with your family, di ba? So,
Correct.
those are the things. Yung, hypertension, that's same, yung hypertension, diabetes, being overweight, ayan, and then poor diet. Ito, sorry if I can, no. So, I remember patients, di ba, like, yun nga, hypertension, cardiometabolic, they would say, kasi ang next na gagawin dyan is to check your blood tests, di ba? Yan. Check for sugar, check for cholesterol, ayan. Tapos, pag mataas ang cholesterol, nagpapanik ka agad. Oh, we have to take cholesterol medications, ayan. So, tapos so parang we have this culture na it's very important to lower your cholesterol na to a point that you will be given medications na ang tataas ng dosage. I'm really scared sa matataas na dosage na yan, di ba? Tapos sometimes we get patients na parang they're taking cholesterol meds as their maintenance medication for the longest time without visiting their doctor for at least, siguro sabihin natin, change in dosage or yun nga, di ba, adjustment. I always get that dati na parang magpapareseta, Dok, resetahan mo ako ng kasi nagtitake ako ng gantong anti-cholesterol meds, pwedeng reseta. Tapos sabi ko, anong latest na cholesterol levels mo? Did you have your blood test? Ay, hindi po, pero maintenance ko po yan eh. So,
tapos like and I also get like ito guilty yung I have like family members who are guilty of this, who have like high cholesterol, and then they see may family member or relative na parang tumaas yung BP, they would share their maintenance meds kasi parang ito yung tinitake ko, take mo na din para makatipid ka. You know, and
that's an internist nightmare, di ba?
It's because ano pa to ito hindi nurse ako, alam ko yan, you know, it's like you're using that, but it's actually a limiting belief system. It has nothing to do with being a nurse. It's just gusto mong makatulong and makatipid, so you are self-medicating.
Sharing medications, di ba? Usually, I ask ni mga patient, sino naman nagreseta sa'yo yan? Sinabi ng kapitbahay ko. Si doktor kapitbahay mo pala yan. Well, we have to understand. Di ba nakakaloka? I will tell patients, we have to understand, number one, we are different from each other. Di ba? So, we have different mechanisms. And number two, also, parang, sige, cholesterol meds. Ayan. So, ang thinking, okay lang maggamot para bumaba. Okay? Sige, fine. I mean, there's yung good intention to lower it kasi we think that high cholesterol is a very bad di ba? So, just to break it down a little, no? So, cholesterol, actually, yes, we want it within the normal values. We don't want it very high, but we don't want it also to be obliterated in your body. Kasi, actually, cholesterol is important. Kasi, and here's the thing, actually, how so important it is, actually, it's our liver produces our cholesterol. Yung tinitest natin na blood cholesterol natin, our liver produces 80 to 85% of our cholesterol for the body.
Oh, wow.
And so actually, if you think about, so that would leave mga 15 to 20% of the cholesterol from the diet na nanggagaling. So if you think about it, it's really the liver. But ang tanong, bakit? So, ganun pala. So, bakit? Kasi nga, ganun ka-important si cholesterol for our body. Did you know that cholesterol is important for us to absorb yung fat that we take? Kasi nga, the liver produces cholesterol and cholesterol produces bile acids. Anyway, very nerdy talk. But to shorten it out, it helps to digest fats that we eat. Okay? Number two, cholesterol helps, alam niyo ba, cholesterol helps in forming our hormones. Ayan. So, yung ating estrogen, ang ating female hormones, di ba? Our estrogen, our progesterone, our testosterone are made, ang ingredients we need cholesterol to make that.
Yeah.
So, kung super baba ng cholesterol mo, it can affect your reproductive system. So, pwedeng mahirapang mabuntis. In short, So, I mean, and then also cholesterol is important in our daily healing and repairing. Did you know that cholesterol is a part of the cell membrane of all cells in our body? So, kung walang cholesterol, paano nila magagawa yung mga cells natin, the membrane, di ba? So, that's also important, okay? So, we don't need, I always tell patients, wag tayo masyadong, cholesterol is not the issue, actually. Kasi we still need that. Too much, of course, yes. Lalo na, itong important too much cholesterol in a setting of chronic inflammation. Siguro naman you've heard inflammation how many times in the past few episodes natin, no? So if in the setting of chronic inflammation, then that's where cholesterol is really, we need to be aggressive with that. Pero hindi cholesterol alone is the issue. That's what I always tell patients. So hinay-hinay tayo sa mga cholesterol meds, or at least guided by our doctors. Kasi if not, sobrang bababa. Yes.
So what I'm hearing from you is that cholesterol and inflammation is connected?
Ano siya Here's the thing, di ba? With cholesterol, we have what we've always heard, yung good cholesterol, the HDL, and then the bad cholesterol, the LDL. Diba? Usually when we interpret our results, that's always the numbers that comes up, diba?
Yeah.
So actually, if we have chronic inflammation in our body, okay, the LDL, the bad cholesterol that they call, no? The reason is kasi that's why they call the LDL as a bad cholesterol, because the LDL is a carrier of a cholesterol from the liver to the body to be distributed in the whole body. So
Got
ngayon, the LDL has this structure na it has this pwede siya kasing mag-deposit sa mga arteries natin. And
mm,
then, kapag na-oxidize yun, because of inflammation, okay, it can be oxidized and that can form yung mga yung kaya mag-harden ang mga arteries natin, and that yan. And then the effect is hypertension, di ba? So, having LDL in your blood is okay kung walang inflammation na magti-trigger na mag-stick yung mga LDL na yan dun sa ugat. That would, di ba? And that's what we've learned, di ba? Parang the
yeah.
cholesterol would stick in your arteries and can cause hypertension, can cause atherosclerosis. Pero yun nga, in the setting of presence of inflammation, that is the case. So, yeah, that's the connection of that one,
So
LDL
if
and
you have high BP, then it's not just cholesterol. That's the thing. We keep blaming cholesterol for everything,
yes.
but it's not
Oo.
necessarily just cholesterol. It could also be
Yes.
inflammation.
Yes, yes. And yun nga, actually inflammation is the first issue. Then kumbaga i-add na lang natin yung cholesterol. So again, tama ka, Cathy, no? This cholesterol is not the parang the number one issue.
Uh-oh.
But yun nga, in a setting of with inflammation, then that's also. So, and also in the setting of inflammation, yun nga, yung other factors, stress, poor diet, yan, the things that we always hear, di ba?
So, Doc, talking about like cholesterol and like it absorbing fat, etc. I'm kind of reminded of like restrictive diets that we kind of tend to put ourselves
Para
on
babaan yung cholesterol.
para
Oo.
babaan yung cholesterol. But then it a lot of people, they turn it into a lifestyle. Like for example, like keto, diba? It's really high fat, as much as possible, very low carbs, etc. And like it's for me personally, it's worked for me in the past, but I do plant-based keto and as advised by my doctor lang. So parang maximum for me is like a month and a half. And then I stop. And then I kind of go back to a regular non-restrictive diet. But like for a lot of people, they like to, it's a lifestyle na, di ba? Parang a year na sila nakaketo, etc. So it's high fat, low carbs, etc. And they say it works for them, but like what are the possible like things that are happening in their cardiometabolic that if with a sustained diet like that?
Yeah, oo. Kasi, like you mentioned, Cathy, no, earlier, when you were talking about you getting the keto, yeah, sikat na sikat ang keto ngayon. So, I have patients, pinagmamalaki pa nila, Doc, last year, ang taas-taas ng mga triglycerides ko, ng cholesterol ko. Ngayon, parang, minsan pa nga nakita akong triglyceride, 1-digit value, di ba? Dahil doon sa keto diet.
Oh,
Here's the
wow.
thing with with keto diet. Just a background. Keto diet was really, parang na-discover yan as a treatment before for epilepsy or seizure disorders. So,
Okay.
that was, parang off-label na lang na-realize din that you lose weight with the keto diet. Pero here's the thing with those, ako, nothing against, lalo na if it's, medically needed. Pero here's the thing with keto, no? It has a lot of, it has to be done the right way. Kasi, tama ka, Cathy, no? Keto diet is very restrictive. High fat, moderate protein, tas low carbs, di ba? The problem with that one kasi, we are, it's a very restrictive diet. Una-una, kung ma-maintain yan nung whoever's doing the keto diet, number 1. Number 2, if you're doing the right. Kasi ito, nightmare din sa akin. No? I've seen this sa, nung nausong keto diet a few years back, nag-start yan, di ba? So,
Yeah.
nandito yung mga TV personalities na pumayat, di ba? And then, they were interviewed in TV and then sabi nila, oh, keto diet's good. I can eat all the chicharons that I want. Like, oh my gosh. Siguro nag-flip na lahat ng mga cardiologists, di ba?
Oh, so, but a friend, yun yung lunch niya araw-araw. He would only eat chicharon. Pero yung naging side effect is medyo grabe yung BO niya after. Parang,
Ayun na nga, di ba? So, there's such a thing as the right keto and the bad keto, no? So, when we say fats, actually, we are emphasizing the healthy fats,
Yeah.
okay? Not the unhealthy fats. So, there's such a thing. So, not all fats are created equal, okay?
Yeah.
So, there's such a thing as healthy fat and then there's the bad fats. So, at saka, we go easy on yun nga, yung mga saturated fats and the trans fats, di ba? Lalo na the trans fats. But anyway, ito lang din ang concern ko with those diets. So, we are concentrating on the macronutrients. The carbs, the count in the carbs, the fats, and then the proteins. Di ba? Yun yung ano eh. But they forget to, yung, why it's also restrictive. Kasi yung micronutrients na papabayaan. So, what are the micronutrients? So, yan, yung vitamins, the minerals, the antioxidants. Hindi yun na-emphasize sa keto diet or at least doon sa mga hindi ganun ka adept with the keto diet, no?
Yeah.
So, it's not about all the macros. We also should have the micro counts din di ba? So, yan, the gulay. In fact, di ba sa keto, merong gulay pa na bawal. So, parang that's complex carbs. So, you also eventually need that. So, in the long run, tama ka, Kati, you cannot stay for long in a restrictive diet like that kasi you tend to, madedeplete ka ng mga micronutrients mo. So, and that also causes our, that also can cause inflammation if too much of the macros without the help from the micros, micronutrients. So, yan, tama na parang a few months. If you will go to a keto diet, make sure that you talk to your doctor very well, who is also, marunong sa keto diet. Kasi, sorry not all doctors knows about that.
Tama.
Diba? Kasi, just a little secret, no? Kasi kami mga medical doctors, wala kaming nutrition subject in our med school that wide, di ba? So that's why siguro ako when I was an internist, purely internist in my first few practices, wala talaga ako alam sa diet. Sasabihin ko lang sa patient, magpapayat ka, mag-diet ka. Hanggang dun lang ang nasasabi ko. Ang patient lalabas sa clinic mo, diet? Anong diet? Paano? So, di ba? So, mali-mali ng diet na nakukuha nila from, di ba?
Exactly. And then they ask their kapitbahay, they ask their family, who don't necessarily know. Like for me, I see a lot of keto diet support groups, right? And then, yun yung mga, okay lang ba ito kainin ko? How to start keto? And it's not, hindi sila doktor they're like other people who are doing the same. And it's kind of, for me, I was telling Doc Candy, I was saying that's kind of dangerous, no? Parang nobody there really is a doctor or a nutritionist.
But they give a lot of advice, no?
Advice. So if you are on the keto diet for a sustained amount of time, what could possibly happen to your cardiometabolic? Because I've been hearing a lot of kind of really bad stories about cholesterol shooting up and stuff like that because they do dirty keto.
Yes. Kasi nga, first and foremost, hindi siya balanced diet So, when you start the keto diet, syempre parang, I look at it like this parang you start the keto diet, you still have that reserves of your micronutrients kahit papano. And then the macro. Kaya ka nga, most of the people who are going into keto are, di ba, most of them naman are overweight, so they want to lose that weight. So, they will enter keto na at the first few weeks or months, okay, kasi they still have the reserves from the overeating nila before na mga macros and micros na yan. Pero as you go along with the keto diet na very restrictive, di ba? So, yung mga, parang options mo of eating yung mga nutrients na technically bawal daw during the keto, like I said earlier, mga complex carbs from the veggies, di ba? May mga bawal na veggies.
Yeah.
So,
because nga walang
wala masyadong fiber di ba? So, in that setting, as you prolong that, so nauubos yung micronutrients mo, and that is very important. Example of a micronutrient, magnesium. Just to if you get depleted with magnesium, that also causes hypertension if you're magnesium deficient. That's one
Okay.
That's one, parang, ako, when I treat hypertension, aside from knowing the root cause, ganyan, I look into the diet because I would want to know, baka may certain micronutrient deficiency in that person causing the hypertension. Kasi if you lack magnesium, if you lack potassium, it can parang it's one of those factors also for hypertension, losing those
Oh.
important micronutrients, the minerals.
So
So
that's why you guys recommend the vitamin D and K as supplementation pag may
those
hypertension.
things,
Oo.
those things kasi yun nga,
Mm.
these are things na parang it's not very parang hindi masyadong natuturo sa mga patient kasi sabi ko nga, Kati, abutin tayo siguro 2 hours if I tell all the micronutrients that are needed in every in every chronic diseases. Like yan, revelation nga when I learned that, after med school na to, na hypertension, important ang potassium, important ang magnesium,
Mm.
important ang vitamin D, pero nade-deplete yun kasi yun nga, with a poor diet, a restrictive diet,
Correct.
and even
Stress.
some
Oo.
stress, and even some medications for hypertension mismo. So
It
that's the
negates
thing
it.
It negates it So, pero 'di ba in conventional management, pag nagkulang ka ng ganito, bibigyan ka ng gamot to replace this. Pero
Yeah.
every medication, unfortunately, there's really some side effects na not really big, pero if you think about it, marami ring mga micronutrients
It
na
adds up
nade-deplete.
also. Yeah.
And it would add up, di ba? Kaya nga complain ng mga patient natin, parang, Doc, 10-10 yung gamot ko kasi number 1 na ipang hypertension, pero may side effect na ganito, kaya may gamot akong ganito. Yung gamot
Yeah.
na to, side effect ng ganito, kaya may gamot akong ganito. So,
Oo. Naloka.
nakakaloka, di ba? So, if we just try to find out, yun nga, like in hypertension, big revelation yan sa akin before na tending your micronutrients, knowing. Kaya sometimes we do targeted supplementation
Mm-mm.
kasi we don't get that from our diet. So,
Yeah. But it
that's
also
also.
comes along with like a diet and a lifestyle
Of
change, right?
course. Actually, here's the thing naman din with supplementation. No? Ang number 1 pa rin natin is to really get your micros and macronutrients from your diet. Kasi yan yung mas na-absorb ng body, yan yung mas recognized ng body. Ngayon, we give supplementation for special cases. Kunwari, you cannot, yung mga special diets nga, or sometimes you don't get to eat really that one because, example lang, you're allergic to a certain food na high sana in magnesium.
Oo.
So, if that's very significant for your case, then we would give you advice on the
Required.
supplementation.
Oo.
So, and also with supplementation, careful din, hindi ka pwede rin mangkopya sa kapitbahay mo ng supplements mo.
Exactly. I think that's something then, parang we all think, oh, we all need a multivitamin and a vitamin C and a vitamin D. And like I have a friend, she takes around like 15 capsules and whatever a day. And I'm like, kailangan mo ba yan? But she just gets it basically. She goes to healthy options and then titingnan niya kung ano to yung wala pa
Choose.
sa. Oo, and then she picks and chooses. I'm like, oh my gosh, that's a very expensive hobby.
Sana ginawa na lang niya, she goes to a local local what you call this, farmers market, mag-choose siya ng veggies instead of choosing bottles. Choose your veggies, 'di ba? I mean, kung hobby rin yan naman niya mamili ng stuff. Siguro start with whole food. Ayan, I think always naman na emphasize ng ating mga centro doctors whole food balanced diet first. Then supplement as needed and with with your doctor's 'di ba, monitoring. Ayan. So wag
Exactly.
gaya-gaya sa
Really,
kapitbahay, sa
really
pinsan.
consult your doctor first because or come into Centro, see one of our Centro doctors.
Yes.
Come in for a teleconsult if you can't come in because like
Yeah.
health talaga is individual. It's not a one size fits all, and I think that's
Correct.
something that people really need to realize. No, see, we have a couple of questions from this is one from Doc Sasa. Hi, Doc Fran. Hi, Doc Mikey.
Wow. Mga supporters.
Man. So Doc Sasa asks, how can we interpret our cholesterol levels? And does having high cholesterol mean that it's bad automatically?
Ay, oo. Thank you for that question. Yan, ganyan. Kasi we see patients na nagpapa-annual lipid profile, di ba? And then gets interpreted, no? So, when we see your lipid profile, it has a lot of maraming components. So, siguro familiar tayo, total cholesterol, the LDL, like I mentioned kanina, the HDL, ayan. Sometimes kasi yung iba, pag ang total cholesterol parang nakita nila mataas from the normal value, nagpapanik na, hihingi na ng anti-cholesterol meds or yung nainom daw nila months back, years back, babalikan nila para inumin. But here's the thing, no? First, be aware that total cholesterol, you should check muna yung LDL component and the HDL. Ayan. And then again, magpapanik, mataas yung LDL ko kasi siya si bad cholesterol di ba? Tapos, and then si HDL nalilimutan, that's a good cholesterol by the way. So, sometimes the total cholesterol is high because maybe your HDL component, which is the good cholesterol, is high. So, okay lang yun. Huwag ka magpanik sa total cholesterol na mataas if the HDL is high. If the LDL is high, again, may iba pang parameters So, actually, the lipid profile test, you cannot take it as as you see the numbers and then na-interpret mo
Okay.
na. Kasi kami among us doctors, meron kaming tinatawag na nire-ratio namin yan. Kasi example, there's what we call the total cholesterol HDL ratio. So, if it's more than, it should be less than 4. Basta may mga numbers na ganyan. So, what I'm saying lang, very complicated, no? Pero, you cannot take it at face value yung numbers na yon. Kasi we correlate that. May mga ratio kami ginagawa. So, not all high total cholesterol is scary.
Okay.
Pero, not all high LDL is scary. Again, depende dun sa pag-interpret nun. Plus, may triglyceride pa dyan. So, yung iba nga, hindi nila alam triglyceride actually is mas scary pa if you have high triglycerides versus the LDL. And it's another big topic, no? Pero, kasi I notice mas fixated tayo sa cholesterol. Pero part of the lipid profile is the triglycerides. And that's also very dangerous kung hindi rin natin papansin what causes that elevation. So that's why, in short, don't get your total your lipid profile na as face value with the numbers. Have that interpreted with your doctor. At seryosohin naman natin ang mga lipid profile tests natin. Not because konti, di ba? I mean, some people they do that just, I don't know for the sake of doing it. Pero siguro nga they don't understand. So, again, we in Centro, we will understand. We will, explain it for you. Ayan, kaya nga sabi ko, madaldal kami, di ba? Lahat ng pakikialaman natin. So,
but I love that because you also educate talaga your patients about what's happening in their bodies, which I feel is something that I don't get with conventional medicine. It usually just is, what's your symptom? Take this and then come back to me in a week. Instead of, this is probably what's happening to your body. And I think the more we understand our body's functions and how they parang interrelate to each other, the more that we can take our health and working on our wellness a lot more seriously.
Yeah, that's true. That's really diba, participatory medicine talaga yan. That's empowerment of the patient. Kasi it's your body, it's not your doctor's body. So,
yeah, they can go to sleep. You're gonna still have whatever's happening with you unless you want to change. We have Marielle Ardiente. She's like, "Hi, Doc Kat, your Alabang Saturday regular here."
Hi. Sinuportahan ako ng mga patients ko, di ba?
Yeah, I love that. We have a question from Wowie Belen. She says, Doc Kat, good morning. I love listening to your lecture. What's the role of genetics in all of these health issues?
Ayan, okay. So, very like I said kanina, di ba, genetics, yes, we always parang put that into account, di ba, the genetics, but like I always say, it's not your genetics, it's not your destiny eventually. It can be part of it, but again, mostly in our mga chronic health issues natin, it took time to develop and something triggered that from outside your genes. So that can be your habits, your poor eating habits, your stressful lifestyle, your relationships, your kulang sa sleep. Ayan. So it can affect. Kaya nga, I don't know if we always say the term epigenetics. So the environment acting on your genes. So anything around you can affect your genes, kaya magma-manifest any health conditions. I mean, that's actually that's the in thing in science right now, epigenetics. So yes, genetics and health issues may role talaga, pero with the help of the environment yan, with the trigger from the environment mo.
I think what's interesting though, like, diba, like at least for me, like I'm such a nerd. Like I love to do these like DNA tests, genetic, like to figure out like what's happening.
Curious din kami sa mga ganyan.
Ano yung mga posibleng sakit-sakit ko? But for me, like it's mostly then in order to, I want to know what I'm prone,
what
I'm
you can be
prone
prone
for.
to.
Yeah,
Yes.
medically prone to, in order for me to make sure that that does not happen to me.
Yes, to do something about it so that it wouldn't manifest, or at least if it will manifest eventually, it would be the milder, medyo
Exactly.
less, ano. So, yes, kaya nga, actually, it's good nga rin sa technology ngayon, may mga ganyang tests na, di ba? So,
Yeah, yung mga ancestry DNA chorba,
oo,
yung mga,
very, very nerdy, pero interesting, di ba?
yeah,
Pero
but
yun nga.
I think kasi a lot of people, like, they look at it, like, for example, like, yun nga, like, they go, di ba, doctors, they love going through, like, family history, ano yung kinamatay
Yes.
ng lola mo, lola
Oo,
mo.
nako, kinamatay niya, ganyan.
But then parang I feel like there's a lot of people who kind of take that and parang, oh, my dad had diabetes, my mom has a thyroid problem. So, eventually down the line, like, one of those makukuha ko, and I'm
Oo.
already living in fear of that possible future. Instead of parang taking it as, okay, sige, so posible ko tong makuha, mataas yung chance. So what can I do today
Yeah, that's
para
the right
hindi
attitude.
mangyari?
Yes.
Yeah.
That's the right attitude na parang, sige, we have the technology, we know na down the line, I can have this. Instead of wallowing na, oh, ito na yung ano ko, this is my
Oh,
destiny. But if you think about it, it's a good way by thinking na, baka I can do something about it para hindi ako mauwi doon. And
mm-mm.
again, we central doctors would be very happy to help you with that one.
Exactly. Like, please come in as for our holistic medical consult. Yeah, either with Doc Hat or any of our other wonderful central doctors. Because again, like, I with coaching, people who go through the elimination diet and are like, oh, I have this, I have that. Um, you know, I usually say, well, suffering is optional. 'Di ba? Parang
Correct, correct,
we
correct.
nasa atin yun eh, parang you can either give in and say, wala eh, sa lahi talaga eh, wala akong
Nako.
magagawa dyan. Or you can take control of your health today, lalo na habang wala ka pang nararamdaman. Wag mo nang
Yes.
antayin na maging
Yan.
diabetic ka before you, like, change up your lifestyle. So Doc, from a functional medicine point of view, like we said, like, the most common cardiometabolic issues that you kind of hear from the clinic is, a lot of hypertension, cholesterol, obesity. What
Mhm.
are some, like, practical things that people can do and start today so they don't go to worst case scenario, which is cardiac arrest?
Yeah, okay. So what you can do today, ayan, listening to us here every Sunday and knowing, parang empower yourself to be your own doctor for
Mhm.
yourself, 'di ba?
But not by self-medicating.
But not yes. Thank you for that one. No? But ibig sabihin nga, parang don't wait na magkasakit ka, na may maramdaman. So, even if you're a healthy person, you're not diagnosed of any medical condition, or maybe your family has this history and ikaw wala, you're okay, you're fine, it's really fine to see a doctor para we can start planning your health future, 'di ba? To optimize your health. So, and of course, aside from that, we always hear naman na having a good diet, sleeping well, exercising as often as you can,
What does
having
it
good
mean, Doc, when you
relationships.
say having a good diet? Because a lot
Ayan,
of
ho.
us have different ideas when you say good
Oo
diet.
nga. Ang hirap
Mhm.
niyan kasi very madugo yan pag sinabing good diet, no? So,
Oo, saka
siguro,
depende. So, like, ako, halimbawa, like, having rice every day is, for me, is not part of my good diet, pero ang hilig ko sa tinapay. So, tinapay ako araw-araw. That's part of my quote-unquote good diet, which isn't necessarily good, as
good.
I found out.
Oo. Kasi nga, yan, that's one example, no? Akala nila na magda-diet ako, so hindi ako mag-rice, so magtitinapay ako.
Mhm.
Una-una ko sinasabi, alam mo ba, 2 slices of bread is equal na to almost a half cup of rice. So, if you eat parang sandwich, di ba? Sometimes hindi ka pa busog with one sandwich, kukuha ko pa ng another
Isa
sandwich,
pa,
di ba?
oo.
So,
Tapos
parang kumain ka
busog
na rin
pa
ng
siya.
rice. Tapos
Oo.
yung palaman pa ng tinapay mo, matamis, let's say, jam or cheesy. Ayan, sorry for So,
Mm-mm.
actually I have been coaching also yung may mga mga weight loss patients, no? I have been coaching them on how to have that balanced diet. Ito
Yeah.
actually sa sentro, we always tell na you should have this healthy plate. Okay,
Yeah.
example. So you mentioned breakfast or ano. So
Mm-mm.
when you prepare your meal on the plate, dapat half of your plate should be veggies and fruits.
Yeah.
Okay, this one, no calorie counting with this one. I know some people are very, parang matrabaho. Ako rin, ayoko ng calorie counting, ha? So,
Mm-mm.
at least to get yung proper portioning of food. So, every meal, if you can add gulay and
Mm-mm.
fruits, mostly gulay, okay, still, half of your plate, and then the other half, i-half mo pa yon. So, one-fourth the carbs, one-fourth the protein. I think
Mm-mm.
that's a good start for
Okay.
you. Kasi eventually yung nitty-gritty nun, yun nga, we can help you with that one, with your need. Again, kasi like we say, iba-iba yung needs natin. Pero as a start, I would recommend every meal, try to add gulay. Tayo, di ba, every meal, ano bang typical meal natin? The fast food meal, the
Half,
protein and the
oo.
rice.
Tapos half the plate is rice, the other half is like tocino and egg.
Yes. Tapos
Na yun.
side dish lang yung gulay sometimes, no? Side
Sarang.
dish pa. Di ba? Parang second thought pa, di ba? So, ang lungkot-lungkot, di ba? Alam mo,
Mm.
if you try, ako, I have this patient, she term it, happy food. Happy food kapag makulay yung plate. So, how
Yeah.
to make your plate makulay? The veggies and the fruits are makulay.
Mm-mm.
Kasi yung fast food, hindi makulay, that's brown and white lang, di ba?
Correct. Yeah.
It's a sad meal. So, and it's not a healthy meal. So, we can start with that one na, yun nga,
Mm-mm.
try to incorporate. Ako, yun nga, try to incorporate the rainbow, sabi nga. So, you said the different color of the veggies, di ba? So, as much as you can. So that you get all the nutrients in one meal. So,
Mm-mm.
I yun yung una kong sasabi in terms of diet. So, of
Mm-mm.
course, yun yung mga, kasi if you eat that full meal na, the veggies and the fruits and the right portion of the carbs and the protein, you won't get gutom in between na para magki-crave ka with, yun nga, di ba? Ang issue natin dyan, cravings or hindi pa
Yeah.
busog enough. Because usually, hindi tayo nabubusog because baka hindi natin nakuha all of the nutrients that we need in that meal, number one. Number two, if you're eating too fast. Ayan, yan yung mga, ito,
Mm.
we're
Oo.
may mga ganyang patients, di ba? Kahit ako
Oo,
before,
ini-inhale yung pagkain.
sinisinghot na lang ang pagkain. Did you know that digestion starts from the mouth? So, if you chew your food well, it takes 20 minutes before your brain can recognize that you're full already. So, if you eat very fast, you always overeat by 20 minutes, di ba? Like I said, it takes
Mm.
20 minutes for your brain to recognize that you're full na.
Oo.
So, yung extra 20 minutes, ang dami pang sinubong extra. So, that's why sometimes,
Oo. May dessert pa.
may dessert pa yan. Ayan. Tapos magtataka ka after a meal, inaantok ka, nang lalambot ka. Kasi
Mm-mm.
ang heavy nung trabahong nilagay mo sa gut mo di ba? Sa dami ng kinain mo. So,
Mm-mm.
ayan. So, having that balance and good portioning of the meal.
Mm-mm.
So, I think
I think that's the biggest relearning, no? Lalo na sa ating mga Pilipino. Because like us as Filipinos, we love to eat.
yes,
Diba?
wala namang masama. Ako, I love to eat also.
Food is such a big part of our culture, but
yeah.
bad food is also such a big part of our,
Unfortunately.
right? Like the
correct.
neon pink breakfast items that like that is on so many Filipino tables in the morning. Like we associate
Correct.
comfort food,
Yes, ayan.
right? But it's not necessarily good for us.
Mm-mm.
Doc Sasa says, maybe for patients, after consulting Dr. Google, have a second opinion and see this
Correct.
to clarify your concerns. Tama.
We would
After
gladly do
consulting
that.
Dr. Google, getting your second opinion from your chismosang kapitbahay, maybe come in and see an actual central doctor, even just for a teleconsult.
And we will sit down with you talaga.
Yeah.
So, yun nga, sabi ko nga before, sasabihin ng patient, Doc, mas mahaba pa yung pinila ko sa clinic versus do sa yung nag-usap with the doctor. Dito sa amin, baliktad yun nga. We will be seeing you for, yun nga, as long as we need to as an initial consult. So, I think that's yun yung, what you call this, that's what's kailangan, di ba? Yung we talk to patients so that we can correct whatever they heard, or at least to validate the opinions that they've heard. Ayan.
Oo.
Nothing wrong with getting information from outside, but try to confirm it with those who are
Yes,
knowledgeable, di ba?
exactly. Get it from a specialist. Get the information or the confirmation from somebody who actually
Yes.
does this for a living.
So, I assure you, very relaxed naman sa sentro when we talk. So, yeah,
Kasi
parang
I think,
kailangan
I think
lang.
it's so normal for us, di ba? Para like makatipid, like we do it for everything, not just health, like
Yeah,
financial advice. We ask our chismosang kapitbahay, but like what works for them doesn't necessarily work for you. So
correct.
really seeing a specialist and them getting to know you a lot better and getting to know what goals you want for yourself, they can actually help educate you a lot more about what's going on with your body, and
Mm-mm.
also really like support you and hold you accountable to whatever change you want to create for yourself. Because I think with a lot of like well, for me, before I came into Centro, my way of thinking was, I go to the doctor to in order to get a prescription for something, and then all my medical issues will go away unless I need surgery. And then I will do surgery and then take a pill and then all of my issues will go away.
Or minsan parang normal na sila, parang vitamins na nila yung mga anti-hypertensives nila, parang vitamins na nila
Yeah.
yung
Oh my gosh.
diabetes meds nila, di ba? So, you don't have to, parang, there's still, if you would, parang, if you would give time for your health, no, there's a chance naman that those, let's say, 10 medications can be brought down to 5, di ba? Ang sarap nun,
Mm-mm.
di ba? If not
Exactly.
0, at least 5 from 10, di ba? So, so yeah, sayang kasi it's doable. It can be most of the cardiometabolic diseases, no? What I can say is it can be reversible.
I really?
So, yeah. So, again, depende sa case. We sit down
Yeah.
and see if this. But ako, I believe, with my practicing as an internist and being in Centro already, I realized, no, na merong nare-reverse na akala natin lifetime na nating sakit. It can be
Yeah.
because we just have to dig what is the root cause of that one. So, kung ma-overpower natin yung genetic component of that, the genes component of that, then it can be reversed, diba? So, yun.
Ah,
So, it's,
okay. Yeah, that makes sense. Doc pala, before I let you go, I forgot to ask about one thing, which is our cardiometabolic system and smoking. So for somebody
yeah.
who is smoking and is like planning on quitting, or for somebody that may, like my dad was a chain smoker. He would go through like 2 packs a day, and that really affected his cardiometabolic system. He was diabetic pa, so
Mm-mm.
that didn't help. um so how does smoking affect your cardiometabolic, and do you have any tips for people who want to stop or want to get their relative to stop?
Well, actually, smoking, no, in terms of smoking, no, parang kami, we also encourage stop as soon as you can, at any age. Kasi yung iba sasabihin na, matanda na ako, so ititigil ko pa ba to,
Tutuloy ko
di
na.
ba?
Oo.
Oo. Actually, tutuloy ko na, di ba? Totoo naman, that's what they say. But the very minute that you stop at any time, you would get immediate results na kaagad. Just to be, example, you stop for, sabi na, for 30 minutes, your heart rate can lower down. Actually, kasi when you smoke, your heart rate can increase. Okay? When you smoke, with all those chemicals in
Yeah.
the nicotine and everything, di ba, in the cigarettes, no? Yung mga components doon can cause hardening of our arteries. And with hardening of our arteries, so you can get
Mm.
atherosclerosis. So, di ba, hypertension is hardening of the
Yeah.
arteries can cause hypertension. So, that's
Oh,
one direct mechanism of that. So,
got it.
anytime that you stop smoking would give a lot of it would lessen the pressure nga in the arteries because of those chemicals that you smoke, you inhale.
Oo.
So, and aside from that, it has a lot of marami talagang chemicals from our cigarettes that can really affect yung ugat natin, our arteries. So, that's why immediate stopping it can really there's already an impact. And that's why sabi ko nga, kahit whatever age you are, it's not too late to stop smoking.
So what I'm
So,
hearing from you is, if you are like, if you do smoke, you run a higher risk of getting a cardiometabolic issue.
That's one
because of
also.
what it does to your body. Okay.
Yes, correct, correct. So that's why, yun nga, with smoking, anytime, parang kasi di ba yung iba, they say, paano ba? Some can stop cold turkey and I'm happy with that one. So, anytime na, what you call this, anytime na you can do it, just do it. Ayan. So,
Yeah.
if you need yung iba would need counseling. So, I understand. Again, iba-iba tayo. So, again, there's nothing wrong to people who cannot stop cold turkey. No judgment here.
Yeah.
Pero, yun nga. So, you can, ask help from your doctor to guide you in, That's why sometimes, smoking cessation, you need, a coach for that also. We can
Yes.
help, di ba? Right, Kathy, di ba?
Yeah.
So, it
There are,
can be,
we unpack that.
yes, yes. So, for those who cannot stop cold turkey and you want to stop, kasi actually may iba, I mean, I don't smoke, no, but some people, they will say, Dok, gusto ko na tumigil, pero hindi ko magawa na tinry ko cold turkey, pero hindi pa rin eh, kasi ganyan, ganyan, ganyan. So,
It's a habit
ako,
na eh. It's a bad habit. And
yun eh.
hirap
And it cannot be
galing.
unlearned in one, tama, habit cannot be unlearned in one, di ba? If
Yeah.
you were able to do it, then good for you, pero not for all. So,
Right.
that's why, yun nga, that's why we here can guide you in that journey also of stopping smoking.
Yeah.
Ayan.
And Doc says like acupuncture also can help with quitting.
Yes, ayan. Next na sasabihin ko. Thank you. Yeah, acupuncture, we have patients who come in for, yun nga, so for cessation of addictions nga, like smoking. So, acupuncture can help with that. We have that. Okay. Even, addiction, I mean, cravings. Ayan, we also have an acupuncture treatment to at least lessen your cravings. But
I
then
need
again,
something
syempre,
for that for my sugar cravings pala. I should tell my
yan.
doctor.
Meron, meron yan. So, that's why, di ba, ang saya-saya na acupuncture kasi meron naman for those. Ayan. But of
Yes.
course, in
Acupuncture
conjunction,
is so broad, but I think
it is.
pero I think a lot of people parang they kind of dismiss it as something woo woo, but it's not. It's really you what I like to tell people who ask me about acupuncture. I know you are an acupuncturist. I'm not, but the pinaka simple way I like to explain it to people is it just helps to bring help blood circulation to certain parts of the body. I think that's the easiest way I like to explain it because they're like, so like what does acupuncture do sa mukha? Sa ano, if it's beauty, what is that? I mean, it basically just helps blood circulation to that area, which is why you look younger, you kind of feel younger. Tama ba? Because there's just more blood going to that area. Plus, it helps if you're into woo woo, it helps balance your chi, your energy.
Yeah, so kasi yeah, in traditional Chinese medicine, no. So acupuncture helps balance the energy because in TCM or traditional Chinese medicine, they believe that yung diseases or diseases that we get is because of that imbalance in the energy. So with acupuncture, we try to balance that energy so that your chi, ayan, will be balanced, then it can get rid of yung mga imbalances or diseases in that
Yeah.
sense. So yeah. So,
Simple na energy, it makes you look better. You
oh,
wanna
sige, para to
get
make
it
it very,
for you, make you feel better, make you look better. You look better.
which is true naman, which is true, di ba? So, yeah, you don't
If
need those,
if you
nerdy
look at our
explanation.
if you look at our central doctors, like lahat sila mukhang fresh, promise. And I'm gonna say it's probably because of the acupuncture.
Saka good
Or
vibes lang all the time, di ba? Good vibes.
oh, super good vibes lang. So
Yeah.
sige, look, we're already at the top of the hour. For people who want to find you at Centro, where do you usually go? What days do you usually go to?
Yeah, oo. Dr. Kat, no, I'm at Centro Alabang every Mondays, Tuesdays, and Saturdays. But every day, Monday to Saturday, we're open. We have our different doctors on duty at Centro Alabang, and then in Pasig, and also in Quezon City. So come visit us, get to know us doctors, Centro doctors, and we'll be gladly chikahin kayong lahat on your
Yeah.
consults with us.
And
Ayan.
we have so many services that can help. So if you do have any cardiometabolic issues, we have our IV nutrient treatments, we have
Mm-mm.
acupuncture, and but first and foremost, come in for a consult, of course.
Yes,
So
yes.
our doctors can come up with treatment plan that would work for you. And hopefully, yeah, get you feeling better. Or if you're not feeling anything at all, but you just want to work on your wellness, I think
Yes,
that's the best time for you to come in.
correct. You don't have to be sick to go to the clinic, diba? So,
You just want to
yeah.
work on your health
Mm-mm.
and wellness, and just to feel better, be healthier for longer.
Again, your genes are not your destiny, okay?
Yeah,
So, you can
I
work
love that.
around that one.
That is my biggest takeaway for today. So yeah, so thank you guys so much for joining us for another wellness weekend. We will see you again next Sunday.
Yes.
Yeah, that's it for now, guys. Thank you for joining
Thank
us.
you for listening. Thank you,
Bye.
Kathy. Bye.
Thanks, Saka.